All right. The question that everyone wants to know is why on earth is there so much compression during a mammogram?
Okay. We have to compress the breast because it spreads the tissues out much better so we can see things that may be hidden in the tissue. So we have to compress the breast. The other most important thing is that it keeps the breast still. So if the breast is moving somehow during the mammogram, then we have blurry pictures and then we're going to miss findings in the breast. So it really helps to keep it still during the pictures.
Okay. And it's definitely still because you're not moving, right? You're being held captive, it kind of feels like. So I know with COVID, a lot of people didn't have screenings.
Mm-hmm.
Does that really matter? Like if I kind of take my time going back in 2021, does a year really matter?
We can never be sure what's going to happen during that year. Okay. But the most important thing with breast cancer is that early detection is the key. So if you come year to year, we're trying to pick things up on the early side when it's more easily treatable. So I don't want women to get discouraged that they missed a year. The most important thing is that you go for the mammogram. That's what we want you there for.
Okay. So there are times where you get called back after you have your first mammogram.
Mm-hmm.
And then when you get called back, it's, oh, everything's fine. Why is that? Why do I have to get called back? Why can't they tell me right away?
Okay. Well, the regular mammogram is 4 pictures. Okay. Sometimes we need to take extra pictures to find out if the finding is actually a true finding. So for example, maybe the breast was positioned a little bit differently in 1 year. Now it looks a little bit different, but on our extra pictures, we've now re-imaged the breast and it looks fine. So we have to take a closer look to make sure, are we concerned about the area? And most people who do come, everything does come out normal. There's only a small population of patients where you may have to go to the next step.
Okay. And is the next step a biopsy?
Yes, that would be the next step. I like to we put things into categories. So the first 2 categories that we give for the mammogram score is everything is fine, you come back the next year. The third category is we're pretty sure it's fine and a benign finding, we're going to watch it. But then the next category, we jump into where the biopsies are necessary. And we can't be certain that there's 95% chance that it'll be okay. And that's when we recommend a biopsy.
And a biopsy, who do you go to for a biopsy?
Okay, so some radiologists who specialize in women's imaging, such as myself, do procedures or biopsies. Okay. There are breast surgeons or breast specialists. They do biopsies as well. I always tell patients we just overlap in some of the things that we do.
Okay, so that would be great if I go to South Jersey Radiology and then you can do the biopsy.
Yes.
I didn't realize that. And when you do the biopsy, what happens?
So what we're looking for is the most important thing during the biopsy is we need to adequately sample the area. So we are women's imagers. We specialize in, these procedures where we're looking under ultrasound. We're guiding the needle to the area after we've numbed up the area very good so you don't feel it. Or we do biopsies for calcifications where we want to make sure we take out or sample them so that the pathologist has adequate tissue to figure out what's going on.
So what's the recommendation? How old for your first mammogram?
So the recommendation is we start at age 40 unless you have some other significant family history. And for those things you need to discuss with your doctor because there are some people who need to start before 40. But the recommendations are that we start at 40 and there's no confusion about that.
Okay, that's great. Thanks so much. It was great talking to you.
You're welcome.